All right, so we're going to go ahead and get started. I just want to say a quick thank you to all of you guys on the line for joining tonight. We're so excited to announce Operation Smile's first COVID-19 conversation. And the topic of this conversation is going to be putting our expertise to work. I'm Laura Gonzalez. I'm Operation Smile's digital content manager, and a lot of my work focuses heavily around our storytelling. I work really closely with my colleague John, and I'll let him introduce himself and then go over some of our kind of rules for the chat.
Hi, I'm John Streit, the managing editor and writer for Operation Smile. And alongside Laura, we've been keeping really close tabs on all of the stories that we're going to be talking about tonight. And, we've been in this unprecedented time, but we're excited to share our initial response and how we're putting our expertise to work with you guys. I'll be moderating the chat area of the webcast tonight. So if you have any questions or want to engage in conversation with me during the webinar when Stuart and Ernest are speaking, just enter it into the chat area and I'll be engaging in there. And then also if you have any questions, I'll be gathering those, and time permitted, we'll ask Stuart and Ernest some questions at the end of our event.
Thank you so much, John. And now I'm really excited to introduce you guys to two of our panelists. We feel really appreciative to have their time today and to hear what they have to say about Operation Smile's response to the COVID-19 pandemic. So our panelists are Ernest Gay. He's our Senior Advisor of Global Business Operations. Ernest brings decades of field-based experience working with nonprofit organizations in sub-Saharan Africa and was honored by the Clinton Global Health Initiative for his outstanding leadership and management of Africare's response to the Ebola epidemic between 2014 and 2015. And Stuart Myers is our Senior Vice President of Global Operations and Programs. Stuart has served in key roles at Project Hope and People to People Foundation. He has worked in 30 countries over 15 years and has expertise in operations and project management. Stuart, Ernest, thank you so much for joining today's conversation.
Thank you for having us. I appreciate the opportunity to share some of the things that have been going on.
Thanks for having us, Laura and John. Appreciate it.
Yeah, so we're going to hop right into some questions, and then as John mentioned at the end, we might have an opportunity for audience participation. So, Ernest, the current pandemic isn't your first experience responding to an outbreak of infectious disease. How did your leadership and management of Africare's response to the 2014 and 15 Ebola epidemic in Liberia prepare you for your current response with Operation Smile in regards to COVID-19?
Yeah, sure. Thanks, Laura. After the Ebola in Liberia, I said to myself that I hope I never have an opportunity to get involved in another epidemic. And wow, 5-6 years down the road, here I am again. I guess it's a true call to our humanity and our profession and what we're passionate about. So, really glad to be here and to be a part of this noble institution. I want to say that infectious disease outbreaks, such as the Ebola virus disease and now COVID-19, do have significant impact on health systems when you have such scale and magnitude as we've had, with COVID-19 that was declared a pandemic. And when we talk about the health system, it's everything inclusive, healthcare workers, the health infrastructure, the testing, and just the whole clinical aspect of it, the testing and diagnosis capability, the clinical solution, and just the surveillance aspect of it as well. So these things are largely impacted, and it is even more impactful when it comes to low and middle income countries. Reason is simple, they just struggle with weaker health systems and competing priorities, and therefore the level of investment that is required for the health system is also compromised by those other competing priorities. And that was the case with Liberia, where I worked, with Africare as a country director. We serve as a partner to the Ministry of Health, just basically trying to help rebuild the health system in Liberia and ensure that essential health services were rebuilt and provided to folks. And so in 2014, we had this epidemic, the Ebola virus epidemic. And one of the reasons why it was critical for us to engage as an organization was we realized that quickly, because the system was so overwhelmed, critical and essential health care, was also compromised. So, at the time, Liberia was recording some of the worst maternal and child health indicators in the world. And therefore, the fact that the health facilities were also overwhelmed, they were unable to continue to provide essential maternal and child health care services. We realized that people were dying from basic, simple sicknesses like malaria. Mm-hmm. And so as an organization, one of the things that I did was to quickly bring back our program team and say, look, listen, as a major partner to the Ministry of Health, this is a health emergency. We cannot just sit and say, we're implementing a development program and therefore deal with the emergency. We'll come back and deal with the post-recovery and the development initiative. So we reprogrammed, we repurposed some of the resources that we had to the response. One, to ensure that healthcare workers and the facilities had the requisite support to respond to any cases of Ebola that showed up at those facilities, but two, to ensure that other essential services were provided. And I think this is the intersect, this is the experience and the skill set that I bring to this. And I'm really pleased with the level of flexibility that has been demonstrated by Operation SMILE and its leadership. Just really want to recognize the senior leadership and our Chief Medical Officer for stepping up, and not just stepping up, but demonstrating and putting forth its extensive network of medical expertise and other resources. I think this is just a phenomenal initiative, that has happened so quickly. I was asked to lead and was able to mobilize a team that we're currently working with. One of the things that we did was, to get out to, through our regional directors, to get out to the respective foundations and program countries that we work in, kind of really try to gauge what the situation was in their respective countries and to understand from them firsthand where the critical needs and gaps were and how we as an organization can engage in a response as a partner, like a true partner to them in good times, but in challenging times. Right. And I'm pleased to say that out of that process, we now have a global COVID-19 response plan and implementation framework that we will be talking about later on, on this call. But just really, it has been a phenomenal experience, really incredible people working with, and I'm so delighted that my experience from Ebola, is really contributing towards our overall global response to support our foundations.
Yeah, it's wonderful to have that expertise that you bring. And when you speak about implementation of programs like this, I think, Stuart, you kind of jumped in feet first when you joined the organization. How have you been able to balance delving into the organization, getting to know Operation SMILE, while also having to deal with such a dramatic disruption in the way that we run our programs typically?
Well, I have to start by saying I'm coming up on the 90-day mark, and I have to say it's probably the most interesting 90 days I have ever spent in my career. I started, I think the day the global conference started, and so was an attendee there, an attendee at the regional directors conference after. And so I got a very good overview of what Operation Smile was, and started to just barely get an idea of how the pieces all fit together. And then the COVID-19 pandemic began. And what that allowed me to do was to see what I think is some of the best of Operation Smile. The easy thing for Operation Smile to have done would have been to say, you know, it's a pandemic. We're not a relief organization. We'll just wait it out. But from top to bottom of the organization, the exact opposite response took place. I think it was a good demonstration of the culture of Operation Smile, the compassion that it has for the people, patients and foundations and partners that we work with. It was also a time to experience firsthand the expertise that is available in the organization. People like Ernest, people like Ruben, the chief medical officer, Doc, and all of the regional directors, country directors and partners, to see all of those people pull together in a response to what became a very serious problem for not just any one of our countries, but all of them together, and to see all of them come together in a very short time frame in a very professional manner was very heartening for me. It was really instructional, but also very heartening.
Yeah, and you both speak about the leadership and the way that you guys, as members of that leadership group, came together. Can you take us a little bit behind the scenes after the pandemic was officially declared and governments around the world began implementing the various mandates that resulted in our medical programs being postponed and international travel being postponed? What were the conversations like when leadership convened and decided that we did need to adapt the way that we're working?
Sure. Ernest, you want to go first? Do you want me to go?
Yes, Stuart, go ahead.
The conversations immediately turned to focus upon what was the impact going to be upon our patients, and furthermore, what was the impact going to be on our volunteers. At the time that the pandemic really rose to the surface as a serious global issue, we still had a number of missions that were planned in anticipation of being able to treat patients, and we had international volunteers and local volunteers all geared up and ready to go. But what really came to the forefront is making sure that the patients were safe and that our volunteers would be safe. That led to a number of discussions around both of those issues, and also discussions with some other NGOs about how they were responding to the virus and the impact on their programs, how looking for possibilities of where, even though our mission schedule may have been disrupted, how we could participate and help at the local level the responses that were taking place, because we recognized fairly early that there was going to be a tremendous strain going to be put on local health systems, and in order to make sure that they were able to respond appropriately, we took action to authorize our foundations, for example, to release supplies and potentially equipment that we had on hand that could be useful in responding to the pandemic. So a lot of discussions around safety and volunteers, but then very quickly also discussions around how could we best respond.
Right. Ernest, did you want to add anything to that?
No, I think that's fine.
Perfect. And so we've seen around the world that our staff and our volunteers have been innovating to serve the needs of the local communities where we're working. Could you tell us a little bit more about some of those innovations, maybe the ones that are most impressive to you or the most out of the box?
Ernest, I'll let you take this one.
Thank you, Stuart. So on the COVID response side of things, so as I said earlier, the leadership decided that it will kind of reprogram and repurpose to really kind of support already, as Stuart mentioned, some of the initiatives that the foundations have stepped up to as part of their own national response as well. So we were able to release some funding to the different foundations, and the funding has been used to support some of the initiatives, like in India, for example, in one of the cities there or regions where we have a comprehensive care center, our regional director and executive director, Abhishek, has worked with his team to address an immediate need of some of the most vulnerable populations. And as you can see from the photo there in the upper left-hand corner, at least from where I sit, they were able to provide food and non-food kind of hygiene kits to go along with families. And this is typical, and we're going to continue to see this as long as this pandemic continues, that vulnerable populations will be faced with multiple challenges, not just with the epidemic itself, but challenges around how do they meet their basic needs and how will they be able to even access healthcare, if they need basic healthcare. So that's something that is happening. In other foundations, they've stepped up, as Stuart mentioned, to donate their supplies to the response, either to their hospital partners or to the ministries of health. We have also provided some trainings as well, to different cadres, and we have webinars that we have set up just to ensure that healthcare workers, frontline healthcare workers, have the basic trainings and skill set to respond to this pandemic. So those are some of the kind of initiatives that are happening. In some other instances, we've been able to provide, the foundations have been able to provide equipment. In Malawi, for example, our team, staying engaged with some of the patients and their families, have also provided income generating training. So families are being taught to produce soap. We thought that was really fascinating and very great on their part, to ensure that they're able to have one of the critical supplies that they need, to continue to protect themselves. I mean, like everybody is saying, wash your hands, sanitize your hands. Well, if you don't have the materials or the supplies to do that, how can you do that in an effective way? And so, that's just one of it. I'll turn out to Stuart to talk about what we're doing from a technological standpoint to continue to stay engaged with some of our patients.
Right.
Sure, Ernest, thank you. One of the things that started roughly at the same time the pandemic started is that we began in Nicaragua to use a digital platform to reach out to patients, for example, who needed services related to speech pathology and potentially psychosocial support. That is a new initiative for us. We are looking at ways that we can, for example, roll that platform out across Latin America. We're also, a number of the local foundations have been doing things with text messaging and SMS messaging, where we've had access to cell phone numbers. We've been able to send a message just to check and make sure that our patients are doing okay and are doing well. So there are a number of ways that we're trying to utilize technology that exists to be able to stay in touch with our patients and also help to respond to the COVID pandemic itself. If you look at the slide that's on the screen now, in the lower right-hand corner is one of the speech pathologists using the platform to communicate with a patient. I think there's a lot of potential in that type of initiative where we might be able to, once you have the platform, there are a number of things you can do across the continuum of comprehensive care that could reach back to our first initial contacts with the patient and getting them screened, getting them into the queue for treatment, all the way through the surgery process, and then even beyond that to additional services that they might need. So we're very excited about that. We think that's something that's got great potential for us in the future.
Right. And speaking of the future, we're getting some great questions in the chat about what returning to normal looks like once we're given the all clear that it's safe to resume, operations as usual. What are we doing right now to ensure that that transition is smooth?
Well, one of the things I think to keep in mind about something like a pandemic, it's a different kind of event than, say, an earthquake or a hurricane, where the event is very concentrated, and then you can immediately move into a relief and recovery mode. The pandemic, as we've all seen, has sort of been a rolling event. Country after country seems to get affected. Our assumption is that countries will come out of the pandemic in roughly the same kind of manner, where there will be a rolling recovery and restart, if you will. So we're working with our regional directors and the local foundations to try to get a handle on what that will look like, both in terms and health. What does it look like in terms of timing of reopening countries, and then what kind of recovery period, for example, is the local health system going to need, where they've been stretched so far to respond to the pandemic. They're likely to have needs of their own in terms of just being able to restock supplies, simple things like restocking supplies, making sure that they have staff available that's well rested and able to participate. And so we're looking for essentially at what we think will be a rolling kind of reopening and restarting. It will be driven by how quickly the countries are able to respond to COVID, but then also how quickly, for example, can they get back to a point where they can do the types of surgeries that we do in the local health system. I don't know, Ernest, is there something you want to add to that?
Yeah, sure. Thanks, Stuart. Laura, I'm glad that you asked this question, because I think it's a critical question for us, and we need to be able to, let people know what we're doing so far, that will kind of pivot us into, implementing our core programs.
Right.
Just a couple of things. One, I think it's important for us to realize that one of the things that such epidemics are really, hits when it comes to health systems is that it erodes the confidence and trust of people in the system. And when I say people, I'm talking about both service providers and those who are seeking the service. So healthcare workers, they want to be sure that they have the appropriate infrastructure, that will protect them while they are providing the services and care. They want to make sure that they have personal protective equipment that can also help to protect them. They want to make sure that they do have the testing capabilities, within their respective health facilities to ensure that, they're providing. And then on the fourth side is that they need to be sure that when a patient walks in, they have the clinical supplies, whether is vaccines, whatever kind of medical supplies that are needed to provide care, that has to be there to assure them. On the other side, patients need to be assured that when they walk into a facility, that shows symptoms, or they feel that they have some kind of illness, may not know, but that facility is equipped to diagnose and to be able to treat and care for them.
Right.
Thankfully, as an organization, through our federated model, our foundations are really stepping up to do that. We're really grateful to have this extensive network of volunteers across the globe that have quickly readapted and adjusted themselves and have put themselves to the front line. So in terms of that assurance, we're already there, and patients are coming in, they're seeing our volunteers, they're seeing our staff, and they show that yes, when things quiet down, it will be easier. We can trust these facilities and these healthcare workers to provide care for us. More than that, through our foundations, and I'll publicly say here that the leadership and with the trust and confidence of our donors and our partners have reallocated funding to support the national response. As I speak to you, we have acquired almost 170 oxygen concentrators. We've acquired over about 200 pulse oximeters, and we have acquired a little over 500,000 assorted personal protective supplies that are all going right now to sub-Saharan Africa and to 2 countries in North Africa. These, in our view, are just part of us reassuring both the service providers and those who are seeking the services that, look, listen, we have the capability, we have the support network. We're here as a strategic partner to you as Ministry of Health, to help you through this process. We will be standing and walking with you to transition back into normal programming. So I think that trust is critical, and I'm really, really very pleased that even those who are our individual sponsors, are aware of what we're doing, and they trust Operation Smile. And I can tell you, clearly for sure that from our co-founders, Bill and Kathy, to our Chief Operating Officer Jim Sadie, to our Chief Development Officer Kendra, to Christy, everybody is working around the clock to really stay engaged with all the different stakeholders, informing them of what we're doing and reassuring them that during this critical period, we're repurposing and we're providing much needed support. Here at home, we were able to provide basic needs to the Centara Medical Hospital here in Virginia Beach. But more than that, through our student programs, you can see, across the East Coast, Midwest, and the West Coast, Kathy and Bridget and Jennifer are working tirelessly with their teams and students to provide hot meals, to frontline healthcare workers. I mean, it is an incredible teamwork here, and trust, in my opinion, is what is fueling this. But the passion and the drive that we have are all additional support to this. I mentioned Ruben, our Chief Medical Officer, who is constantly engaging his colleagues in the medical field, and our regional medical officers. So I can, safely say that with the support, and what is already going on in the respective foundations and program countries and through our regional directors, I can see a seamless transition back into our programs. Now, 2 things that we are aware of and we're working on right now to ensure that is also included. One, we do realize that the infrastructure, particularly when it comes to our comprehensive care centers, we're now working with a medical directors in those foundations where we have care centers, the EDs and the regional directors, to ensure that the infrastructure is properly equipped to triage, patients as they come in, so that in the future, if we ever, and God forbidding it, to have similar situation, that staff and other patients are not at risk, when they walk in. We're doing trainings right now, through, we're doing a lot of virtual trainings. We are partnering with other organizations, to continue to ensure that frontline healthcare workers have the appropriate knowledge and skill set to really, provide the care, but in a safe manner.
Right. Yeah, I'm hearing a lot of this trust and compassion, which I feel is our core values of our organization. We are at time, but Stuart, did you have any kind of closing words you'd like to add?
Just that, the event has been unprecedented, and all organizations are trying to figure out how to respond in the immediate sense, and how to position and come out of the pandemic. I think Operation Smile will not be an exception to that. We are actively reviewing how we do, for example, our mission activities, and what that will look like in a post-COVID world, where there may be restrictions on the size of groups that you can get together, how long they can stay together. So there are going to be some adjustments along those lines that we will need to look at, and we're working our way through those. But very optimistic about and positive about the response we've made and what the future looks like for us moving forward. The organization is a great organization. It's got a very critical role to play. We're going to make sure that we play the role in the current situation, but also positioning ourselves to continue to play that important role as we move forward. I just appreciate everybody's effort and support.
And thank you both, Stuart and Ernest, so much for joining and for sharing your expertise with our audience. I know they appreciate it. Just as a FYI, you guys will receive an email tomorrow with some follow-up information. Hopefully this is the first of many conversations on this topic, and thanks again.
Thanks for having us again.
Of course. Bye, everyone.